Hi everyone, this is Dr. Nalli Ramya. I'm ENT and head and neck surgeon JIPMER, and today we are discussing about the most common surgery that is done worldwide, that is sinus surgery. And you might be thinking most people who will be suffering from sinusitis, they will be having so much of headache and cough, cold and even facial pain. And when the medicines are not getting worked up and we are dealing with the patients of low immunity, then sinusitis is one of the common conditions that are seen when your immunity is low. And it can not only present with headache, but it can be presented with various complaints, even like single cough, or your nose might be constantly having discharge, and you might feeling some kind of heaviness in your head, and your face might be paining. These all comes under sinusitis. Your doctor will be evaluating about what is the most common cause, what is that is triggering your sinusitis. What is really sinusitis? When you cut your face, means like if we have a cross section of our face, there are some air cavities that are present in your face. These help in regulating our air currents and respiration and help to maintain the weight of our face over the neck, and there are various other functions that your sinuses are having. And it is also dealt with various other things like your smell also. So sinus has so many functions that are present. It is indirectly, your sinuses will affect your taste also. You are having your nose problem, then you cannot even taste your food. So that's why the sinuses are very much important. Then why we are dealing with surgery? Any sinus symptoms, we want to cure your sinus symptoms. If it is not getting cured with the medications we are giving, and your smell is getting low, and your drainage of your sinuses is not proper, and these all symptoms will be manifested, then we will go for the sinus surgery. And the sinus surgery, what we most commonly do in our surgical basis is FESS, functional endoscopic sinus surgery, where it is also dealt with like even the tumors of your sinuses. If you are having any cancers or any benign conditions which are not cancerous, and some growths in various other growths that include polyps, and these polyps may hamper your various daily functions, and that time we will do this sinus surgery. Once we have planned the sinus surgery for you, we will always see the various investigations that we are doing beforehand. It is like when we have given the medications for you and your problem is not getting cured, then we will go for the surgery. And what are the conditions that are present in your sinus problem, we will be seeing, because we have already thought that there are various conditions that will aggravate your sinusitis. Which one is blocking your sinus opening, we will see that. We will do the endoscopy first. We'll see what is the problem, whether your sinus is because of the nose bend that is present, or is there any bone that is impinging on the sinus mucosa. These all can be seen with the endoscopy. And with the endoscopy, we'll see and we'll record it, and we'll make it sure that everything, what is the problem, we will see in a visualized manner, and we will plan for the surgery. And then we will take the CT scan also to see how your inside of the sinuses, what are present. We can differentiate between the only secretions or any growth is present with the CT scan. And if there is any abnormality of the bone present, we can see with the CT scan. It is not only that one, but the proximity of the different structures that are present in your sinus, and the different mucosa lining, how is the mucosal lining, or is there any cancer that is present, or is there mucosal origin or muscle origin or even bone origin, we can be finding with the CT scan. Once we have done, then we will be seeing the blood investigations. We will see the blood investigations. If everything is fine, we will see the clotting time and bleeding time, all the blood parameters. If it is okay, fine, then we will go ahead with the sinus surgery. This sinus surgery, FESS, is mostly we are discussing today about the FESS, functional endoscopic sinus surgery, which was done so many places. And apart from the FESS, there are other kind of surgeries also in recent treatment, like balloon sinoplasty, where we keep the balloon in their nose and will expand the opening of the sinus opening. And another thing is lasers we can be using. These are various conditions, but we are discussing today of the basic way of doing the sinus surgery, that is FESS. And this FESS is very much made the life of doctors and patients very much easy. Why? Because previously we used to cut from outside, we used to keep an incision from outside, but because of the FESS there is no incision making outside and you will not see any scars outside. So because of this, the life of the patient has been, means like the suffering of the patient has been so much reduced that they are able to do daily to daily activities in a very good manner, and it has become a very minimal invasive surgery. So after that we will be doing this surgery either in the general anesthesia or in the local anesthesia. So general anesthesia, when we are planning general anesthesia, we will make sure whether the patient is anxious, or we will see whether the patient is cooperative or is there any other comorbidities that are present, and the doctor will decide whether you have to go into general surgery or local, means like a general anesthesia or local anesthesia. Once we will be planning for that, then we will see that the patient is not having food for about 6 to 8 hours before, not even water. So before the admission we will admit the patient and we will see that he is having all the blood parameters normal, he is having the antibiotics taken before course, so that we always give antibiotics before course for the any surgical basis, because the inflammation will be decreased so much that the bleeding of the patient will be decreased. So antibiotic course is, and we also see that the patient has stopped smoking if he or is taking the smoking, and then we see that 2 to 3 weeks he has stopped the smoking, so that the healing process and the scarring process will be decreased and healing process will be so much increased for the patient. And we make sure that he will not be taking any medications that cause bleeding also, like aspirin we will not allow the patient to take, and NSAIDs, ibuprofen, like that, so we will not allow him to take, he or she. And there are other kinds of medications also, like St. John worts interact with your anesthesia, so we make sure that he or she is not taking that. And also we make sure that any anticoagulants, means like that medicines that will hamper your bleeding, means like it will cause bleeding. So for few conditions like heart diseases or any other diseases where we will be using the anticoagulants, we will stop it beforehand. So because of this, the patient will be very much less prone for bleeding in the operative field and post-operative also. And what happens really during the surgery? During the surgery, we will make sure that patient is comfortably placed on the bed, and we will make sure that he is fine. And during the general anesthesia or local anesthesia, we will inject the anesthesia drug, and we will make sure that he or she is in unconscious mode. In local anesthesia, he will be seeing everything what we are doing, but he will not be in a very conscious mode, that he will not perceive so much of pain also, but he will be conscious. And doctors talk with the patient when we do the surgery also. So we do the surgery while we are talking with the patient. So when we are talking with the patient, we will be knowing how he is feeling. So we will inject the anesthesia, local anesthesia, inside the nose, and we will give a local anesthesia in the veins of the hands also, and we'll make sure that he is in a semi-conscious mode, and we'll make sure that he will not perceiving any pain. We make sure that he is not having any discomfort. Then when we will see what is the cause of the problem, and if it is the DNS, deviated nasal septum, then we will correct the deviation nasal septum, or if there is a blockage of the nose because of the polyp, we will remove the polyp, or if it is only because of the drainage, the opening of the sinus is small, and we will widen the sinus opening. This is, we will remove few structures inside the nose, that is not so much, but it will help you for the drainage of the sinus. Means like there are various structures present, like uncinate process or widening of the that area, so that the patient will not have the recurrence again and again. Many people have so much of doubt that the sinus is recurring again and again. It's not like that actually. Various factors we will be seeing in beforehand, and we'll make sure that the patient is not facing the sinus repeated symptoms. So we keep the medicines as well as surgery in both hand in hand, and we make sure that the repeats will not, but most of the time patients will be fine. But sometimes we make sure if any repeats, it can be regressed also, so don't worry about that. Sometimes it happens, but it is a very minimal chances that the patient will get recurrence, but if it is present also, we can revert the condition. So by using various managements present with medicines also, we can revert the condition. But sinus surgery will help you in decrease so much of pain for the patient that he or she will be very much happy after the surgery. So after this surgery, we will keep the nasal packs inside the nose and we will leave it for 1 or 2 days based on the bleeding that is present in the, and we will also keep, if necessary, plates that are present. We will keep it for about 7 days and we will later remove it operatively in OP basis. Once these packs will be removed in 1 day, and during this process we make sure that we are giving the IV antibiotics to you, and any bleeding we will see post-operatively. We will see if any eye swelling is present, any restricted of eye movements are present, or any bleeding is present inside the mouth. We make sure that these all factors are very much good in nature, and we'll make sure that patient is not suffering with the pain, and patient will not suffer most pain. And during the pack removal, he might be having a bit of pain, but later on he can set up his normal work basis. And what are the post-operative precautions that we will be taking? Only post-operative, we will be seeing a bit of bleeding. That is okay, common. A bit of bleeding is normal. It doesn't mean that you are having any much of complications, or you might feel a bit of fatigue also. That is also not. A bit of pain also might be present, but that is not a horrible pain that you cannot bear. But with the medicines, you will be feeling bit of good only. You will not feel much of very bad pain that is not present. So during this period, we will make sure that you are not suffering, you are not doing various activities like exercises, or you are making your pressure over your nose. Like we will tell the patients to stop your exercises for about 1 week, so that they will no stress on your body, on your nose. After 1 week, we will make sure that you can do 50% of the pressured work you can do. We will not allow him or her to lift the heavy weights or nose blowing during this period of time, so that we will give the medications as required to avoid these allergic symptoms that are present, so that he or she will not be having these nose allergy problems. After 2 weeks of doing this surgery, you can go ahead with the routine work. During this period, after the post-operative surgery, we will give nasal sprays, means washes. That how to do the nasal washes, and you make sure that these nasal washes are done in a very good manner, because all the blood clots that are present inside your nose should come out. So it depends on the patient also how well they are doing their nasal rinsing. How many times you want to do, you do the nasal rinsing. Minimum you do it at least 4 to 5 times a day, so that all the clots will be coming out and you will be feeling fine. We will tell them to not use this like aspirin, ibuprofen or naproxen. These tablets are not to be taken during this post-operative period, because there might be chances of a bleeding also present. So we will make sure that he is taking the well nasal rinses. So sometimes we will give mild decongestions if there is a small kind of bleeding that is present. What are the conditions that you should be keeping in your mind while this post-operative? You have to see if your fever, is there any fever? Initially post-operatively there will be a bit of fever. Any means like tissue injury, but we are doing any surgery. After surgery there will be mild fever that is present. That is common, but we will be seeing if the temperature is increasing or not, your eyes are restricted or not, you are having eye swelling, is any fluid that is coming from your nose, any watery discharge that is present, you are having severe headache after the surgery, or you are having any neck stiffness, and if there is present, then you have to immediately consult your doctor that you are having these problems, and he will see what is the issues that are present, and immediate care will be taken. And apart from that, after post-operative, after 2 weeks, you will be resuming your work normally as before, and you can do. So many people might be thinking that, oh my God, after surgery you will be taking rest. No, it is not like that. It is a minimal invasive surgery, and you can be doing your work normally. Only thing that 1 to 2 weeks is the maximum period we are taking a very good care. After that you will be normal. If you are finding any of these symptoms present during these initial stages, you tell your doctor. This will help you in post-operative means like recovery rate so much fast. And these also help you not only in improving your smell or your sinus headaches or cough or cold also. This will improve your quality of life. For few conditions we always correlate these surgery with other surgeries with when you are having a tumor of the face. This is a basic surgery we are doing, and these have proved very nice that the patient's quality of living is very good. So if you are going through the sinus surgery, make sure that you are following these precautions. After the sinus surgery, many people are very good. Initially they might be feeling a mix of nasal congestion and blockage initially because of the blood clots and everything. Later they will be recovering well. If you feel that this episode is very much informative, so that you can share that with your friend who is undergoing the sinus surgery or who is undergoing the sinusitis problem, so that this is not a very big painful surgery, or it does not cause any scarring. It will help you from getting out of the various issues of these sinusitis problem that will be recurring again and again if you don't take the normal medication. Hope this episode is useful. Thank you.